Okay, welcome back. Now, please allow me to introduce our next presenter, whose paper ID is 351. Manal Hamda, a second-year student in the Biomedical Engineering Master Program at the IFC Biomedical Engineering School, located in France. She had her undergraduate degree and completed her first year of the master's program at the International University of Health Sciences, Abulcasis, located in Morocco. And this will be her first participation in an international conference. Today, she will present his paper titled Lunatum Prosthetic Replacement, Modeling Based on Volume Rendering of CT images. Welcome.
Yes, thank you.
Okay, you can open your camera.
Yes. First of all, allow me to thank you for accepting my article and giving me the opportunity to present it in the MICAD conference of the year 2022. This work was done in collaboration with the International University of Health Sciences Abulcasis and the Simulation Center of Sheikh Zayed Foundation, both located in Morocco. As you can see from the title, the main objective of this work was to create a lunatum prosthetic replacement based on 3D reconstruction and modeling techniques. The modeling process was based on volume rendering of CT scan images. To put you in the context of this work, I'll start with a general introduction. So additive manufacturing, also called 3D printing, has multiple applications in health field. Given the example of reconstructive surgery, surgical planification, education, and prosthetic creation. However, the main field of application of these techniques remain in reconstructive surgery and prosthetic creation in orthopedics for bone and joint replacement. In hand surgeries, one of the major applications of 3D reconstruction and 3D printing is in the case of Kienbock disease that affect lunatum, which is a bone from the carpal bones. So carpal bones are the bones forming the wrist, and Kienbock disease or osteonecrosis, which is a vascularization problem, considered to be the main cause of carpal bones collapses, especially the lunatum. In the case of advanced stage of Kienbock disease, replacement with a prosthetic is required. Lunatum arthroplasty or lunatum replacement with a prosthesis has shown great outcomes when it comes to Kienbock disease cases, and that was proven by clinical trials. However, the failure rate causes were unclear, which led us to two hypotheses. Either the used biomaterial was non-biocompatible, or the prosthesis shape might be not adequate. The used biomaterial was clearly mentioned in clinical records, and they were all safe to be used in case of implanted objects and clinically proved. However, the prosthesis shape or modelization process was poorly described, and with the tendency of the use of multiple size kits that contain 3 to 5 prostheses or lunatum prostheses with different sizes, and the final shaping is carried out by the surgeon. We suggest that the prosthesis shape might be the main cause of the failure cases. In that context, the main objective of this work was to create a 3D model based on simple process consisting of volume rendering and 3D printing, with the goal of preserving the anatomical properties of the lunatum in mimicking its shape. So for the methodology material we utilize to create our 3D model, we use volume runner, which is a set of techniques that allow the visualization of 2D image in 3D volume. After that, we manually segmented the lunar bone from the rest of copper bones. Then we selected the biomaterial and proceeded to 3D printing to transform the digital model into physical objects. For that, we utilized Physics Lesson, which is an open source software for visualization, processes, segmentation, and analysis for medical data. This software has multiple techniques such as volume rendering and segmentation tools that we utilize in our case. And for the 3D printing, actually the 3D printing techniques depends mainly on the selected biomaterial. In our case, we worked on FDM. Even though the main objective of our work was to create a lunatic prosthetic replacement in the case of Kimball disease, we developed an automatic segmentation mask with the purpose of reducing the consumed time in manual segmentation, which will give better diagnosis and accurate classification of Kimball disease. For that, we utilized MATLAB, which is an open source software for numerical computation and image processing. As for the utilized data, we worked on CT scan images of a patient case with scaphoid fracture. And the main cause of using this kind of data is to test the accuracy of our segmentation mask and see if it can segment the lunatome even though there is an external perturbation, which is the scaphoid fracture in this case. So after data acquisition, we did image processing to enhance the quality of medical images, and after that we proceed to automatic segmentation mask development. As for the biomaterial selection, the listed biomaterials were mainly used in the lunatum arthroplasty in case of Kimball disease, and the Swasson silicone rubber implant was the first one to be utilized in that context. However, it was eliminated because of its kiss formation. We also eliminated pyrocarbon biomaterial, even though it shows good outcomes. However, those clinical outcomes were based on short-term follow-ups, which doesn't necessarily reflect its efficacy. And we also eliminated the cobalt chromium and its alloy because they were labeled as potential carcinogens. This table resumes all the compared aspects of the remaining biomaterials, and the best one was polyethylene. Polyethylene requires less investment compared to titanium in terms of biomaterial and 3D printing technique, and it also has less side effects compared to the both remaining biomaterials. Now for the results we obtained, I'll start with presenting the automatic segmentation mask. As you can see from the images, the mask allows exact mapping of the lunat and perfect isolation from the background. And as mentioned before, we utilized DICOM data with the patient presenting scaphoid fracture, and the main objective of this was to evaluate the accuracy of segmentation of our mask, which was proven since the lunatome was perfectly segmented from the rest of the background. And this mask will allow better diagnosis and classification of Kimball disease. As for the 3D reconstruction, we utilize volume rendering techniques that allow the visualization of 2D images in 3D volume based on different 3D scan cuts. In our case, it was coronal, sagittal, and axial cuts. The next step was to segment the bone or the anatomy bone, and we segmented directly from the hand 3D model. And after that, we printed in two sizes, the normal size and a bigger size, just to highlight the anatomical similarities. As you can see from the images, these techniques allow a high anatomical similarity in terms of shape, dimension, curves, facets, even though the half moon shape, which is very particular to the anatomic bone, was preserved. To conclude our presentation, this is a synthesis of our approach step by step. The advantage of this approach is the simplicity of modulation process and the anatomical accuracy with the original bone. Generally, 3D slicer is utilized in 3D reconstruction for educational purpose or for surgical planification. As for our results, they have met the main objective since the resulted model was anatomically similar to the bone. However, the clinical outcome wasn't evaluated in this project since it requires a long-term follow-up, at least 1 year, and that's what we are considering for our future work. This methodology can be applicable in any case, but it will be more beneficial in the case of small bones reconstruction, such as carpal bones, given the fact that it gave us good results in case of lunatum bone, which is relatively a very small bone. So our perspective for future work is to generalize this method and develop a standard protocol applicable in case of any implanted prosthesis creation. And by that, we came to the end of our presentation, and thank you for your attention. Yes, thank you for your attention, and sorry for the technical problem.
Okay, thank you.
If you have any question.
If you still have some questions, please feel free to ask. If there are no questions, thanks for Amanda for his excellent speech.
Thank you.
Thank you.
Thank you so much.
Thank you.
Goodbye.